cutting-edge research, global collaboration, DLC remains at the forefront of ophthalmology in China. On the occasion of our 16th anniversaries, we are excited to host the International Ophthalmology Hospitals Presidents Summit. We welcome you to unite in Guangzhou for this precious ophthalmic assembly and immerse yourself in the charm of South China. In terms of research, DLC houses China's only state-key laboratory of ophthalmology, focusing on cutting-edge research in stem cells, neurobiology, and artificial intelligence. We have been ranked #1 by the Science and Technology Evaluation Matrix for 10 years in a row. Our pioneering work has positioned us on the top list of Nature Index for Eye Institute's research output. DLC serves as a national education base for PhD students and clinical residencies in ophthalmology. Our graduate students and alumni have achieved national recognition, with many becoming professors at renowned international universities. A study published in Nature has revealed the alarming surge in myopia among Chinese students. The myopia prevalence among children aged 15 has reached the unprecedented level of 78%. This myopia boom among children has drawn widespread attention from scholars both in China and abroad. However, myopia research faces multiple challenges. For example, myopia screening is limited to a concentrated sample population and a singular screening method. Conducting myopia research is resource-intensive due to its complex heterogeneity and challenging in individualized prediction of myopic risk. To address these issues, artificial intelligence offers a novel approach by simulating the neural networks of human brain, enabling rapid learning and uncovering potential patterns in data. AI provides cost-effective solutions with fast diagnostic speeds and has been extensively applied in various medical fields, including ophthalmology. Recently, there has been a growing interest in medical big data due to its ability to predict future outcomes, offering distinct advantages including unified resources, reliable data, large-scale analysis, and self-identification of patterns. Consequently, it is highly suitable for conducting myopia research. Today, I will introduce several studies we published previously related to myopia and big data analysis. As we all know, China has experienced major increases in myopia prevalence, influenced mainly by environmental factors. Indirect evidence suggests a potential association between green space and myopia, as urban children with limited access to green spaces exhibit higher prevalence of high myopia. Due to the challenges in quantitatively assessing green spaces, few reports have evaluated such relationships. Satellite technology has offered new insights into epidemiology and its application to human health. It can be used to monitor and measure the green space environment. The Normalized Difference Vegetation Index, NDVI, is used as the measure of overall green space exposures, where ranges between -1 and 1, with higher numbers of number indicating more greenness. Therefore, we use satellite technology to assess the green space exposure in primary schools and analyze its relationship with risks of school myopia. We conducted this study in Shenzhen, the largest immigrant city in China, which is undergoing rapid urbanization. A total of 113 schools in Shenzhen participate in this study. We included school children from grade 1, about 6 years of age, and to grade 4, 9 years of age, representing a period of rapid refractive error changes. Eye refraction data were collected annually from 2016 through 2019. We generate NVIDIA maps from the original high-resolution Gaofeng 2 satellite images to assess green spaces within the boundaries of the schools. To evaluate the potential impact of seasonality, the time integrate of monthly NVIDIA values in our study period were calculated. We also calculated the green space morphology of the campus and the surrounding buffer zones. 0.25 was the threshold value of NVIDIA used for green space patches extractions. As landscape metrics were then obtained to measure area, aggregation, and shape of the green spaces. 0.1 unit increase in the NVIDIA were associated with a 3.6% low increase in the myopia prevalence at school level and 27.9% reduction in the myopia risk at the student level. Further analysis of morphology metrics of green spaces revealed that increased proportion, aggregation, and cohesion of green space was correlated with slower progression of myopia. In addition to investigating potential of green space for population-based myopia prevention, we have also focused on population-wide myopia screening models using artificial intelligence technology. Slow analysis using convolutional neural networks, CNN, we can discover subtle facial features that clinical doctors find hard to identify, thereby achieving recognition of genetic disease. Therefore, this study aims to utilize the fine-grained recognition capability of CNN for screened myopia children. We collected 2,350 ocular appearance images from 1,175 children in a standardized scene. Other information, including refractive and demographic data, were also collected. We resized the ocular appearance image to 224 plus 224 pixels and extracted facial features using a widely employed CNN VGG face with transfer-link learning. The algorithm can distinguish between myopia and non-myopia using a VGG face network. In the validation test, our DLS achieved an AUC of 0.927, a sensitivity of 81.13%, and a specificity of 86.42%. The risk of children developing high myopia has become a great concern and burden for the healthcare system. Therefore, identifying those at the greatest risk who should undergo target therapy is of great clinical importance. In the next study, we have developed a prediction algorithm based on machine learning techniques to uncover the key determinants of high myopia and accurately predict its development in adulthood at an early stage. We extracted data from more than 500,000 electronic medical records collected between 2005 and 2015. We employed the random forest machine learning approach to develop a predictive algorithm, utilizing age examination, SE, and annual progression rate as input variables. The algorithm was used to predict SE and whether patients will progress to high myopia in the subsequent 10 years. Our algorithm provides high precision predictions of high myopia as early as 8 years in advance. This study for the first time used large-scale data collected from electronic health records to demonstrate the contribution of big data and machine learning approaches to improve prediction of myopia progress in Chinese children. The system has been deployed on cloud platform at Zhongzhou Ophthalmic Center. Based on medical big data and interdisciplinary technology, we conducted a comprehensive analysis of macro-level greenery indicators of affecting myopia, implemented intelligent screening with facial features, and produced an intelligent prediction model for high myopia over 10 years. Our findings provide novel insights for prevention and management of myopia at both population and individual levels. Thank you for all your attention.
So that's terrific.